Greetings. The invisible threat. Imagine something so small that millions of them could exist without being visible to the human eye. Viruses are microscopic infectious agents that depend on living cells to reproduce. They are not considered fully living organisms in the same way as bacteria or animals. Outside a suitable host cell, a virus cannot reproduce on its own. Yet despite their microscopic size, viruses have influenced human history on an enormous scale. Some viruses cause mild illnesses, others can lead to severe disease, and a few have caused devastating outbreaks across populations. But what makes a virus dangerous? It can depend on several factors: how easily it spreads, how severe the disease can become, whether treatments or vaccines exist, and how quickly scientists can detect and control an outbreak. In this documentary, we are going to explore 15 viruses that have had major impacts on human health. Some are ancient threats, others emerged more recently, and one of them became responsible for a global pandemic that changed everyday life for billions of people. Smallpox virus. For centuries, one disease terrified communities around the world: smallpox. Smallpox was caused by the variola virus, a virus that spread primarily through close human contact and respiratory droplets. The disease could cause fever and a distinctive widespread rash. For much of human history, there was no reliable cure. Smallpox outbreaks could move through communities and leave enormous numbers of people seriously ill. But humanity eventually achieved something extraordinary. Scientists developed an effective vaccine, and international vaccination campaigns dramatically reduced transmission. In 1980, the World Health Organization officially declared smallpox eradicated. It became one of the greatest achievements in public health. Today, naturally occurring smallpox transmission no longer exists. Its history, however, demonstrates an important lesson. A disease that once seemed impossible to defeat can eventually be controlled through science, cooperation, vaccination, and sustained public health efforts. Ebola virus. Deep in the forests of Central Africa, scientists first identified a mysterious disease in 1976. It was later associated with the Ebola virus. Ebola belongs to a group of viruses known as filoviruses. Certain Ebola infections can cause severe illness, including fever and problems affecting multiple body systems. Unlike viruses that spread extremely easily through the air, Ebola transmission generally requires direct contact with infected bodily fluids. This characteristic means outbreaks can sometimes be contained through rapid identification of cases, isolation, protective equipment, contact tracing, and other public health measures. One of the most significant Ebola outbreaks occurred in West Africa between 2014 and 2016. Thousands of people were affected across several countries. The outbreak pushed researchers to accelerate vaccine development and improve treatment approaches. Today, Ebola remains a serious public health concern in regions where outbreaks occur, but medicine and public health systems are far better prepared than they were decades ago. Marburg virus. Ebola has a close relative with an equally intimidating reputation: Marburg virus. Marburg virus belongs to the same broad viral family as Ebola. It was first recognized after outbreaks in Germany and Serbia in 1967, associated with laboratory workers exposed to infected African green monkeys. Marburg disease can be severe, and outbreaks have occurred in several African countries. Like Ebola, transmission can occur through direct contact with infected bodily fluids. That means infection control measures are extremely important. Healthcare workers can face particular risks when treating patients without appropriate protective procedures. Modern outbreak response focuses on early detection, isolation, contact tracing, safe clinical care, and community cooperation. Marburg reminds us that emerging infectious diseases can appear in unexpected places, and that rapid scientific investigation can make a major difference. Rabies virus. Few viruses have such a dramatic relationship with the animal world as rabies. Rabies is caused by the rabies virus and primarily affects mammals. Transmission most commonly occurs through the bite or scratch of an infected animal, because the virus can be present in saliva. Once clinical symptoms develop, rabies is almost always fatal. But there is an extraordinary difference between rabies and many other deadly viruses. Rabies is preventable after exposure when appropriate medical care is obtained promptly. Post-exposure treatment can prevent the virus from reaching the stage where severe symptoms develop. Vaccinating domestic animals also plays a major role in reducing human infections. Dogs remain an important source of human rabies deaths in several parts of the world. Rabies, therefore, provides one of the clearest examples of why seeking medical attention after a potentially dangerous animal exposure is so important. HIV. In the early 1980s, doctors around the world began recognizing a mysterious pattern of severe immune system problems. Scientists eventually identified HIV, the human immunodeficiency virus, as the cause of AIDS. HIV attacks important cells involved in the immune system. Without effective treatment, the infection can gradually weaken immune defenses. But HIV is also a powerful example of how medicine can transform a deadly disease. Antiretroviral therapy can suppress HIV to very low levels, allowing many people living with HIV to live long and healthy lives. Treatment has changed the disease dramatically compared with the early years of the epidemic. However, HIV remains a major global health issue. There is currently no broadly available vaccine that prevents HIV infection, and scientists continue working toward better prevention and treatment strategies. The history of HIV shows that medical progress is not always about discovering a single cure. Sometimes, controlling a disease can itself represent an extraordinary scientific achievement. Influenza viruses. Influenza may sound ordinary. After all, seasonal flu is something many people encounter. But influenza viruses have repeatedly demonstrated their ability to cause enormous outbreaks. Influenza viruses constantly change over time. Occasionally, a new strain emerges that can spread through populations with limited existing immunity. The 1918 influenza pandemic caused an enormous global loss of life. Later pandemics, including those in 1957, 1968, and 2009, also demonstrated the continuing threat posed by influenza. Scientists around the world monitor influenza viruses closely. Each year, seasonal vaccines are updated based on predictions about which strains are likely to circulate. Influenza is therefore more than a seasonal inconvenience. It is an evolving viral threat that requires constant surveillance. SARS-CoV-2. In late 2019, doctors in Wuhan, China, reported cases of an unusual respiratory illness. Scientists eventually identified a previously unknown coronavirus, later named SARS-CoV-2. The resulting disease was called COVID-19. Within months, the virus had spread across the world. The pandemic affected healthcare systems, schools, workplaces, economies, travel, and everyday social life. Scientists moved at extraordinary speed. Vaccines were developed, tested, and authorized in an unprecedented period of time. Researchers also improved their understanding of how the virus spreads and how severe disease can be prevented. SARS-CoV-2 demonstrated how quickly a respiratory virus can move through a globally connected population. It also demonstrated the importance of international scientific collaboration. MERS coronavirus. Before COVID-19, another coronavirus had already attracted global attention. It was called Middle East Respiratory Syndrome Coronavirus, or MERS-CoV. MERS was first identified in Saudi Arabia in 2012. The virus can cause severe respiratory illness. Unlike SARS-CoV-2, sustained community transmission of MERS has been much more limited. Many human infections have been associated with contact with infected dromedary camels or transmission in healthcare settings. MERS became an important warning for scientists. It demonstrated that coronaviruses circulating in animals could cross into humans and sometimes cause severe disease. The experience gained from studying MERS also contributed to the broader scientific understanding of coronaviruses. SARS-CoV-1. In 2002 and 2003, another coronavirus caused an international outbreak. It became known as SARS-CoV, or SARS-CoV-1. The disease, severe acute respiratory syndrome, could cause serious respiratory illness. Cases appeared in multiple countries, creating international concern. But public health authorities were able to contain the outbreak. Measures such as identifying cases, isolating infected people, tracing contacts, and implementing infection control procedures played major roles. No ongoing community transmission of SARS-CoV-1 has been reported since the outbreak ended. The SARS experience became an important chapter in modern infectious disease preparedness. Years later, when COVID-19 emerged, scientists already had valuable knowledge about related coronaviruses. Yellow fever virus. Yellow fever is an ancient viral disease associated with tropical and subtropical regions. The virus is primarily transmitted by infected mosquitoes. Symptoms can range from mild illness to severe disease. In severe cases, the infection can affect the liver and other organs. Fortunately, an effective vaccine exists. Vaccination vaccination has played a major role in controlling yellow fever and protecting people who live in or travel to areas where transmission occurs. Mosquito control is also important. Yellow fever demonstrates something fundamental about infectious diseases. Sometimes controlling the disease means controlling not only the virus itself, but also the environment and organisms that help transmit it. Dengue virus. Dengue is one of the world's most important mosquito-borne viral diseases. It is caused by dengue viruses and is primarily transmitted by Aedes mosquitoes. Millions of dengue infections occur globally each year. Many infections are mild or cause no symptoms, but some can become severe. Dengue is especially challenging because there are multiple closely related dengue virus types. People can become infected more than once. Climate, urbanization, mosquito populations, and human movement can all influence where dengue transmission occurs. There are vaccines and prevention strategies in certain settings, but mosquito control and avoiding mosquito bites remain important tools. Dengue demonstrates how closely human health can be connected to environmental conditions. Zika virus. Zika virus became an international concern during major outbreaks in the Americas during the 2010s. Like dengue and yellow fever, Zika is primarily transmitted by Aedes mosquitoes. For many infected people, symptoms can be mild or absent. But Zika became especially concerning because infection during pregnancy can be associated with serious birth defects. The outbreak led scientists to investigate the virus rapidly and study its transmission, effects, and prevention. Zika showed how a virus that causes relatively mild illness in many adults can still create serious consequences in particular circumstances. It also demonstrated the importance of monitoring diseases that are transmitted by mosquitoes. Hepatitis B virus. Hepatitis B virus, or HBV, primarily affects the liver. It can cause both short-term and long-term infection. Chronic hepatitis B can increase the risk of serious liver disease, including cirrhosis and liver cancer. But there is an important weapon against HBV. A highly effective vaccine exists. Vaccination programs, especially vaccination during infancy in countries where hepatitis B is common, have significantly reduced infections. The virus can spread through infected blood and certain body fluids. Public health strategies therefore focus on vaccination, safe medical practices, testing, and preventing transmission. Hepatitis B is a reminder that not every dangerous virus creates a dramatic global outbreak. Some viruses cause enormous harm quietly over many years. The future of viral threats. After exploring 15 dangerous viruses, one question remains. What will the next major viral threat be? Scientists cannot predict the exact virus that will cause the next outbreak, but they can prepare. Researchers monitor viruses in humans and animals. Public health agencies track unusual disease patterns. Scientists develop vaccines and antiviral medicines. Hospitals improve infection control systems. And international organizations work to coordinate responses when outbreaks cross borders. The story of viruses is not simply a story of danger. It is also a story of scientific progress. Smallpox was eradicated. Vaccines have prevented countless infections. Treatments have transformed diseases such as HIV. Modern technology allows scientists to identify new pathogens faster than ever before. But viruses continue to evolve, and new diseases can emerge. That means preparation must continue even when there is no global emergency. The most dangerous virus is not necessarily the one with the most frightening reputation. The real danger can come from a combination of factors. How easily it spreads, how severe the disease becomes, how quickly it is detected, whether effective treatments or vaccines exist, and how prepared society is to respond. Viruses may be microscopic, but understanding them requires cooperation on a massive scale. And perhaps the most important lesson from the history of deadly viruses is this: humanity does not defeat infectious diseases through fear. We fight them through knowledge, science, prevention, preparedness, and cooperation. The next outbreak may be impossible to predict, but our ability to prepare for it is something we can improve. And that may be our greatest defense against the invisible threats of the future.